Next very important topic is the tumor. That means musculoskeletal tumor. You know, at least 1 to 2 questions are going to be asked every time you sit in any paper related to entrance into the post-graduation. All right. So let's have an introductory discussion of the tumors before actually talking about the tumors. You know, one of the sample question is that which of the following is a feature of active benign tumor of the bone, and we are provided with several of the options like no treatment is required, extracapsular, malignant transformation is possible, and pathological fractures are possible. Next, not a criteria in a staging of a bone tumor according to King. Which of the following is not taken into a criteria for classifying the bone tumor according to King system of classification? So let's have a discussion on the classification itself, because all the 2 questions that we have talked about are based upon the classification of the bone tumor itself. Now, classification for you to remember is the King system of classification, and King, like any other bone tumor, are classified. They have classified the bone tumor into 2, that is benign and malignant. You know, the benign tumors are further categorized into 3 types. That means latent, active, and aggressive type of the benign tumor. Now, these are the features of a latent, active, and aggressive based on their comparisons. Now, as the name indicates, latent type of a tumor. Latent means it is inactive kind of a tumor which is kept inside the bone but is not harmful to the bone and the body. So it is a non-expanding kind of the tumor. It is well located within the confines of the origin. That means it is intracapsular. It is asymptomatic almost all the time, and there is no risk of the pathological fractures also. Now imagine a tumor which is so silently kept inside the body that most of the time it is the incidental finding in order to diagnose this tumor. So no treatment obviously is required until and unless it is diagnosed. All right. And the example is a non-ossifying fibroma. Like, you know, there are examples. All the benign tumors are further categorized in the examples, like which one is latent, which one is active, which one is aggressive. So in the examples of a latent kind of a benign tumor, we are having non-ossifying fibroma. Next, on the other hand, the active kind of a benign tumor is slightly going to be more active, more pathological compared to latent kind of a benign tumor. Now, what happens in case of active? It will be a expansive kind of the benign tumor. It will be expansile. It will be having a increased size over a period of time. Expansile kind of a benign tumor. Second is intracapsular. That means most of the time it is well located within the confines of its origin. It is symptomatic over a period of time. Maybe late symptomatic, but it will be symptomatic. Risk is always present related to the pathological fractures. All right. And the examples are simple bone cyst and aneurysmal bone cyst are the examples. But as far as aggressive kind of a benign tumor is concerned, as the name indicates, it is a kind of a benign tumor which is more fulminant in comparison to the previous 2 categories. So in aggressive benign tumor, what will happen? It will be rapidly expansile, kind of a rapidly, progressively expansile. It will be extracapsular. It will breach the boundaries of its confinement. It will always be symptomatic. It requires extended curettage. It requires management. All right. With the expansion all up to an extent of removing the normal bone also. So extended curettage would be required in order to remove this tumor. And the risk for pathological fracture is always present. Now, aggressive benign tumor, one more important feature is that they can go malignant. There is always a possibility, although less, but there is always a possibility of this tumor can be turned into a malignancy. And one such prime example for aggressive kind of a benign tumor is a GCT, that means giant cell tumor or osteoclastoma. All right. This is how the benign tumors of the bone are categorized according to King into 3 stages, like is latent, active, and aggressive. And if you look at the first question, the sample question itself, so what was the language? That which of the following is a feature of an active kind of a benign tumor? So active benign tumor, which of the following is a feature? If you look at the first option, no treatment is required, it is a feature of latent. So this is not the answer. Extracapsular is a feature of aggressive. So this is not the answer. Malignant transformation is a possibility more in case of aggressive kind of a benign tumor. That is also not the answer. So pathological fractures are possible. Yes, pathological fracture can happen in active kind of a benign tumor. All right. Next, after having a discussion on benign tumor, next we have a discussion on a malignant tumor. Now, malignant tumors simply are divided into 3 stages. That means stage 1, stage 2, and stage 3. Stage 1 and 2 are further divided into A and B. So stage 1A, stage 1B, stage 2A, and stage 2B. But the third stage remains the stage 3. Simple. So these are the stages. Now, how these stages means 1, 2 and 3, or how the malignant tumors are categorized into stage 1 and 2, it is based upon the histological grade of the tumor. You know, if the histological grade of the tumor is low, then they are stage 1 tumor. But if the histological grade of the tumor is high, they are stage 2 tumor. Alright. Then how this stage 1 is further classified into stage 1A and B. So both these two stages are further subdivided into stage 1A and B, similarly 2A and B, based upon the location of the tumor, whether it is within the confines of its origin or it has breached the confines of its origin. That means whether it is intracapsular or it is extracapsular, whether it is intracompartmental or is it extracompartmental. So if a low grade malignant tumor is intracompartmental, it will be stage 1A. But if the low grade malignant tumor is extracompartmental, it will be stage 1B. Similarly, if a high grade malignant tumor is intracompartmental at the time of diagnosis, it is stage 2A. But if the high grade tumor is extracompartmental at the time of diagnosis, it is stage 2B. But what is one thing which is common in both these two stages? That it has not yet metastasized. That means the tumor has not yet metastasized, because if the tumor metastasizes to any other distant organ for its involvement, then it will be categorized as stage 3, irrespective of whether it is low grade or high grade, whether it is intracompartmental or extracompartmental. So this is how the stages of malignant tumors are aligned or distinguished. Now, you know, out of this table, it is very difficult to formulate a potential question. Like, you know, in case of benign tumor, we have given you a question that all of the following are the features of active except, or which of the following is a feature of latent, which could be a feature of aggressive. So this table is filled with a potential type of the questions for your examination. But only question that could be asked out of this discussion of the malignant staging is that which of the following is not taken as a criteria for classifying the malignant tumors of the bone according to Annexing system of classification. Now, in this case, what we have given in the options as location of the tumor, whether it is intracompartmental or extracompartmental, so it is a criteria. Metastasis, yes, alone, if it is present, then it will be classified as stage 3. Histological grade of the tumor, yes, it is responsible for classifying the malignant lesion into a type 1 and type 2, but size of the tumor is not taken into account. Because, you know, all the other staging systems, majority of the staging systems of classifying the malignant tumors, size of the tumor is an incorporated component within the tumor classification systems. But here, in case of Annexing system of classification for malignant lesion, size of the tumor is not taken into account. So that is the only potential question which could be framed out of this particular topic. After having a discussion of what we have talked about related to the introductory part of the tumors, now is the time to discuss about the individual tumors. You know, the tumor related question comes with the sense that the examiner wants you to rule out other 3 options and reach the diagnosis. Like what we do in practice, it is not like that if the patient comes to you, then just by looking at the clinical features, by correlating the signs, by correlating the X-ray findings, MRI findings, you will diagnose the tumor. No. First, just by looking at the symptoms and the signs, you will make a differential diagnosis. Then you will narrow down this differential diagnosis by investigations. Then you will further narrow down this differential diagnosis by additional sophisticated investigations. And finally, you will order for the final diagnostic investigation. In most of the cases is the biopsy, histopathological analysis of that tumor. So that is the approach in identifying a tumor. That is the approach what the examiner wants you to learn. So there are 2 ways of learning about the tumor. One is that you start with the osteosarcoma. Then you learn about chondrosarcoma. Then you learn about osteochondroma. Then you pick up the 4th tumor. And there is always a possibility by the time you start learning about the 4th tumor, you have lost everything what you have learned for osteosarcoma. And this is in cycle will happen. And the possibility of marking the correct answer based on this approach is extremely less likely. But what happens if you read the tumor based upon the tables, then the possibility of marking the correct answer will be much easier. And this is what we are going to learn, that how the examiner is asking about the tumor is something that you have to learn about. Alright. So first of all, divide all the tumor based on their locations. all of you are aware of the fact that a single bone is further categorized or is further divided into several of its components. There are several components in a single bone. Like there is a epiphysis, then we have got the metaphysis and the diaphysis. Similarly, the tumors can also be divided into epiphyseal origin tumor, the metaphyseal origin tumor and the diaphyseal origin tumor. So this is the first table that you have to remember. Out of the epiphyseal tumors, the only two tumors that you have to remember which are originating out of epiphysis is the chondroblastoma and the osteoclastoma. All of you know that osteoclastoma is actually the GCT, that means giant cell tumor, and the chondroblastoma. So these are the two epiphyseal tumors which you have to remember. Next are the metaphyseal tumors. Now the metaphyseal tumors are osteosarcoma is a metaphyseal tumor, then chondrosarcoma, then osteochondroma, that means exostosis, it is a metaphyseal tumor, then osteoblastoma. Apart from this, the simple bone cyst, which is unicameral bone cyst, similarly aneurysmal bone cyst. So both of them are the metaphyseal tumors, and finally the enchondroma. So at least these are the tumors that you have to remember based on its location. We already came to know about that, giant cell tumor and chondroblastoma are epiphyseal in location, while osteosarcoma, the chondrosarcoma, the osteoblastoma, the osteochondroma, simple and aneurysmal bone cyst as well as enchondroma, they are metaphyseal in location. And finally, what you are left with is the diaphyseal tumors. Now, Ewing sarcoma, the multiple myeloma, then osteoid osteoma, then adamantinoma, and fibrous dysplasia. They are primarily the diaphyseal in locations. So having constructed this table or having remembered or learned this table, you can easily rule out or you can easily mark the correct answer related to questions like all of the following are metaphyseal tumor except which of the following is a diaphyseal tumor, which of the following is the epiphyseal tumor, all of the following are diaphyseal tumor except. So that is the first set of questions that you have to prepare for. Every time you read a tumor, the first thing that should come to your mind is that what is the primary location of that tumor? Is it a metaphyseal, diaphyseal or the epiphyseal tumor? Next is, what is the most common bone which is likely to be affected by that particular tumor? That means for that tumor, bone which is most commonly affected. So for that,